Chair, I believe the first item is the call to order.
Yep.
Would you care to call the meeting to order?
Yep, sorry. Yep. So thanks for coming, everybody. We are going to get started with the meeting. Appreciate everybody being here on a Monday. And I believe we started recording. Thanks, Amy.
Thank you. Are you ready for the next item, Chair?
Yes, please. Let's move on to the next item.
Okay, next we have roll call. So Chair Cancino,
Present.
Commissioner Hobson Cord,
Present.
Vice Chair Junio,
Present.
Commissioner Perez,
Present.
Commissioner Yee,
Here.
Commissioner Delgadillo,
Here.
and last we have Commissioner Sanders. Don't see Commissioner Sanders. We can see if she joins later. Great, so everyone else is in attendance, and then I'll also note we're joined in this call by Assistant City Manager Sharon Reynolds. We also have Police Chief Scott Campbell and Captain Adam Plank from the Police Department as well.
Cool. Thank you, Amy. I definitely want to acknowledge our new commissioners, Stephen Yee and Salvador. I can't say that. I can't say that name. My native tongue won't let me say it, but I'm gonna give it a shot. Delgadillo. Did I get that right? Hopefully. So again, welcome to the commission. Definitely appreciate you guys being here. And I think with that, we might have a full commission now, I believe. Cool. Perfect. All right. Thanks, Amy. Next item.
Next is the reading of the land acknowledgement, which Commissioner Yee has volunteered to do, and I'll share my screen so we can read along. Okay. Commissioner Yee?
Great, thank you. We want to acknowledge that we gather in San Mateo County on the traditional land of the Ohlone peoples past and present, and honor with gratitude the land itself and the people who have stewarded it throughout the generations. We honor and respect the Ohlone people's long history here that reaches beyond European colonization. We honor and respect the indigenous people who lived and continue to live upon this territory and whose practices and spiritualities are tied to the land and its other inhabitants today. Thank you.
Cool. Thank you, Stephen. Next on the agenda item, we have agenda review. I hope everybody has had enough time to review the agenda. Look at that again right now. Does anybody want to make any changes to the agenda? Nope, I don't see anybody, see any hands. Okay.
Chair, through the chair, we will be joined by the mental health clinician in the police department, Mika Celli. She requested to be a little later on the agenda as she's coming out of another engagement. Okay. So hopefully she's here by about 1/4 past, 1/2 past. If she's not here, I propose doing one of the last items on the agenda and circling back. And also, we designed this agenda with the chair to have a little bit more breathing room, more time. But if we run out of time at the end, the retreat could potentially be pushed to discuss at the next meeting.
Mm-hmm.
Thank you.
Oh, perfect. Thank you, Amy. All right. Well, then let's move on to the next agenda item, which is public comment. Amy, do we have anybody here from the public or anything emailed?
I see one person on attendees, AS. I'm not sure who that is.
Amy, I'm
could-
sorry. Did we motion to accept the minutes?
Not yet. We're at before the matters for consideration.
Okay.
Cool, perfect.
Yeah, there's one person in attendees. I could just promote them.
Okay, sounds good.
They've also raised their hand.
Perfect.
Hi.
Oh, I'm sorry. Could everyone hear me, Chair?
Yep, we can hear you.
Yes. Oh, this is Olga Perez. I'm sorry I'm joining in late. I was not prepared. I didn't have anything prepared, but if I may just say just a couple of comments. I just briefly just saw the agenda literally perhaps like about 10 minutes ago, and I was really, it really caught my attention. And please excuse me if I mispronounce her last name, Miss Sally.
Sally.
Oh, Sally, excuse me. Yes, Miss Sally, in her presentation. And, you know, the subject about mental health and how it pertains to our servicemen who are here to serve and protect us, as well as it also pertains to the Old Town community, who it's not only a disadvantaged community, but, you know, social economic, you know, it's in a different level than, you know, that I believe, you know, exists anywhere else in South San Francisco. And I think it's the community, I believe it's not fully understood, and at the same time it's misunderstood. And I'm going to be very honest. You know, I was raised in the Old Town area, and I also raised my children in the Old Town area. And I think it just, with me being open and honest, I'm hoping, you know, there will be an understanding, you know, about our community and what our lived experiences. And if you could just, you know, just bear with me. I'm sorry, I didn't have anything prepared. But just through our experiences, how mental health is, for example, like if we find the need, you know, to call a police officer or ask for assistance, there's already, how would I say, a person is already under a lot of stress, or there's already high emotions, you know, coming into that, you know, so there could just be a little bit understanding and have more of a human empathy that, you know, going in, whether you arrive to someone's home or somewhere, wherever that telephone call is being placed, you know, that the officers already have that understanding. And it definitely does not help when there's not that understanding that, you know, that we are left with an even, our mental health is affected even more by that experience. And, you know, and it leaves us really traumatized when we're not understood, or where, you know, for example, where the way that we are treated, or how, you know, there is already a preconceived notion, you know, just because of, it doesn't necessarily mean, you know, that because we are Latino or Black and Brown communities, but it has a much more impact, you know, in the Old Town area and outside of the Old Town area, wherever, you know, there's already, you know, we are already, because of our experiences, because the way we were treated, or because the way our children were treated, we're already going in there, you know, with a distrust, and with not a very, how to say it, we're going in already, you know, very distrustful, very uncomfortable, very stressed, very, should I have calls? Should I not have calls? And then at the same time, on the other level, when the way we are treated, it's not good when we are left even much more traumatized. And I'm not going to go into details, but just keep that in mind, how it really, really affects our mental health. And but anyway, just keep that in mind, please. And then also in regards to the Old Town community, which differs from I believe, anywhere else in South San Francisco, besides perhaps the Willow Gardens area, where the socioeconomic, factors really do take a huge role. I believe in the way that we are treated, the way we are perceived, and there's a lot of, prejudices, discriminatory factors, and I'm speaking through my life experience, through my family's life experience. If you could just please take that into consideration. And Miss Salai's, experiences, what she learned in Sojourn to the Past, I've always instilled that in my children, and they happen to be attending that program, and it did really bring to light what I have, instilled in them, and what I have taught them. And it's very, very difficult for us, to live our lives, with prejudices and and discriminations. It's just very, very difficult. And that program, really, really caught my attention. And what I am trying to do, in my work, through my voice, not only here in the commission, but really trying to bring a voice to a very misunderstood and not understood community, and a silent community that has gone through a lot of trauma, and including, our family. I was hoping to be able to hear Ms. Salai's presentation before I spoke. Thank you.
Thank you so much, Miss Perez, for your from your comment. Just wanted to validate that you are right, that mental health is definitely a big priority right now of the city, considering that we do, they piloted this program with the San Francisco Police Department. And even with the recent event of last week, with the hoax that went around, our community is shaken up. A lot of the teenagers, a lot of the schools are definitely shaken up, and we should respond to that. So I know that Mika Sally has been working with the community, but definitely just want to validate your ask, and definitely letting you know that it is the city's priority to work on mental health services and making sure that we can address that.
Yeah, if I may, just one very quick comment. I know there's a person or an individual that's dedicated, when the calls are made, focusing on mental health, but I was wondering to see whether there's also a person dedicated for understanding the Old Town community. If there's any consideration in hiring a personnel that works within the police department that truly understands our community in the Old Town area.
Right. That's definitely questions that we'll take back. I don't know if we can answer that right now, but I think with the presentations that's coming up in the next couple months, we'll definitely have answers for that.
I think, Chair, if I may.
Of course.
I think at that item on the agenda too, you can also take public comment if you wanted to.
Perfect. Thank you, Amy. Yeah, we could definitely do that. Thank you again, Ms. Perez. All right. Is there any other public comments, Amy? Any correspondence or anything? Perfect. All right. let's then move on to the next agenda item, which is introduction to our two new commissioners, Salvador and Stephen. I believe they might have prepared a little something to introduce themselves. Possibly, maybe, we'll put you on the spot a little bit. But maybe just, yeah, here we go. Thank you, Amy. All right, I'll hand it over to Stephen and Sal.
So we're gonna. Okay, so since I voiced already, I guess I'll continue my voice. And sorry for my raspy voice. I've been talking all day. And I appreciate the prompts in terms of the commissioner introductions here. Again, my name is Stephen. Definitely thrilled and honored at the same time to be part of this commission here. In a nutshell, in the context of how I see things, I consider myself to be not necessarily just a calm in the chaos, but in the chaos, I seem to get more clear. Not that we want chaos. My point is, when things are very, complex, I'm very comfortable with it. The issues that we are hearing, Ms. Perez share a little bit about her perspective today among the many other voices, the mosaic of our community. We are a fabric of very complicated or complex people, but it's not very complicated that we are looking to be one community. And that's one driven aspect about this commission that really fuels me to help facilitate that all voices are represented. My background, it taps into a variety of things here. I mean, and I would say the most recent, most relevant, probably interesting aspect is I guess technically I'm still on it, but we've already wrapped it up. The Community Advisory Committee to the General Plan of 2040. I've been involved with that over the several years. I've learned so much, and the more I learn, I feel like I don't know enough, and that drives me to understand that there are many stories that have yet to be unveiled. To have us really truly understand who we are as a one community is a process, and I think one thing I was very, very impressed with the Community Advisory Committee is how we try to reach to many different sectors of every different part of South City. Do we do 100% well? No, but what it does say is that there are many, many good, willing people to really, really have a better life for us as peers, as citizens. What I hope to bring to this commission, I think I mentioned this to you. I'm very comfortable with looking at the complex. I understand the long play, and if needed, go deep dive into the analytic weeds if necessary. I just want us to be mindful of what we're doing in a very thoughtful and intelligent and deliberate way. What would I like to see this commission achieve? In and of itself, I took a look at the bylaws, and of course the intention was truly facilitating the pure, as close as possible to the pure essence of equity, that all voices are being heard, and in a very, very open, transparent way. I might sometimes, if I'm a little impatient, it's because I know there's so many things that we can do. At the same time, I'm new to this group, so I know I need to absorb a lot as well. And I'm just looking forward to this commission being open and very energetic. It's not just good for ourselves, but I think it's what the community really is looking forward to. Thank you.
Thank you, Stephen.
You're welcome.
Appreciate that. Definitely looking forward to working with you. And now if we could hear from Salvador.
Can you hear me?
Yep, we can hear
Hi,
you.
hello, everyone. Thank you. Hello, honored to meet everyone and to be on this commission. My name is Salvador, and my identity is he, him. My background is in community psychology and expertise. At the moment, I'm a family partner with, as at Star Vista Crisis Center. And I was, privileged in working with an, very diverse background, a social work background in addiction, to foster youth, all in San Mateo and San Francisco County, foster youth, the juvenile hall, and what I hope to bring to this commission is just that experience and, having, low wage, intense labor, immigrant, non-English speaking family, first generation experience in Old Town, where we first arrived, and we all had to be cramped up, undocumented just to get by, that poverty, conditions and everything that comes with that, low education, and that was really painful experience having low educated parents and family. It was very, looking back, it was, I don't recommend, it was painful. What I would like to see this commission achieve is just that, is equity, and increase our equity across the city, and the public safety. And get to really know each and every one of you, and really build a team and collaborate.
Thank you, Sal. Definitely appreciative, and just wanted to let you guys know that your experiences are definitely valuable. So also really excited to work with both of you. Yeah, we'll do good things together.
Thank you, Crystal.
Yeah. All right. Next on the agenda, Amy.
Next, we have approval of meeting minutes from September 19th, 2022. If someone would like to make a motion to approve the minutes.
I motion, Stephen.
And I'll second the motion.
Thank you, Stephen. Thank you, Carol. Perfect. Welcome, Carol. I saw you pop on minutes ago, long time ago. So I'm glad you could make it.
Sorry, I was like, it's school.
No worries. I'm just happy you're here. Cool.
Do we do a quick roll call vote for the minutes?
Please
Okay, Chair Cancino,
approve.
Commissioner Delgadillo,
Yeah, approve.
thank you. Commissioner Hobson Cord,
Approved.
Commissioner Junio,
Aye.
Commissioner Perez,
Approve.
Commissioner Sanders,
Approve.
and Commissioner Yee.
Approved.
Okay, thank you.
Perfect. Thank you. That's approved. Next on the agenda item, we have debrief and fault discussion from the Equity Commission from October 6th. I believe a bunch of us had done a tour with Sergeant, I forget his last name. I know it's Sean. I can't remember his last.
Kermie.
Kermie, yeah, Sergeant Kermie, a personalized tour with Sergeant Kermie. So just wanted to kind of like make space to see if people wanted to talk about that, their experiences. I think as a whole, we definitely all found it very helpful and definitely like insightful to see things behind the doors. So definitely wanted to open that up for commissioners to talk about that, their experiences there. Anybody want to start? Stephen, you're already unmuted, if you don't mind me calling on you.
I'm allowing, wait, equity, right?
Yeah. You're talking
Equitable
a lot
access.
today. You got to catch up.
Okay, I must admit, there is quite a bit of reading. Thank you, Amy. And everybody. Sure, maybe a couple highlights. And it's interesting, if I may, because I attended the Citizens Academy years back, and for a moment, I'm slipping my mind. It was many years back, and it was a different kind of tour. It was interesting to kind of do the walkthrough logistics that time. What was really different is to have Sergeant Kermie, Sean, as he shared with us, really give us a behind the scenes look, not just in terms of the operations, but really the issues that they're facing and how they're shifting as best as they can to be a more of a look forward aspect of the community. It's an intriguing challenge that they are in. It's not an easy position to be in. They have to make super split decisions at given circumstances. So I just want to say that at a high level and allow others to circle around. But it's a very extremely difficult position for them to be in, to make split second decisions at the same time. There's a lot of efforts in doing proactively a lot of good things that's going to be for the benefits and benefit and overall wellness of the South City community for the long run. And one more thing, if I may, I think literally every, I don't know, logistically is going to be pretty much, but I really think every single citizen should go through the likes of the police tour, and not just that department, every department. But that one was really, really kind of convincing to say every citizen should really go through that. Thank you.
Thank you, Stephen.
Sure.
Anybody else want to say anything? Paula, Claudia, you look unmuted as well, and I think you went to the tour as well.
I did. My husband and I were fortunate to be able to take that tour with Sergeant Kermie, and it was so much, to take in. It's a beautiful building. Police department here in South City definitely deserves, a department like that. My husband and I were both really impressed. We had a chance to go into the evidence area, which I found pretty interesting. Got to understand how the police department really secures that evidence, and Sergeant Kermie gave a pretty good explanation on how long the evidence is kept and the different types of evidence that is kept, and it's a very wide variety of things that are kept there, and how it's checked out, and it's just very secure, and that's comforting, and it was just very interesting. And then had a chance to check out the gym, which is great, because I'm all about workplaces having thinking about considering the health of employees, and definitely this building definitely is considering the health of the police department. And then had a chance to check out the 911 dispatch, emergency dispatch center, and that was pretty impressive as well. That's a very important part of the police department. So many different departments, also very important, And I just thought that my husband and I both said the same thing, that Sergeant Kermey did such a fantastic job at showing us around, explaining everything, was very patient. It was great. We didn't want to leave after. We felt so connected afterwards. But yeah, it was great. So I definitely recommend that if anybody hasn't had that opportunity, you should definitely get to know the police officers in your city and where they work and what they do. So I was very impressed. A+.
Thank you, Paula Claudine. Yeah, definitely want to mimic all of what you said, like the person, like seeing the officers just like as people, not just as officers or law enforcement, like.
Yeah,
definitely
I
want-
think it's really important to connect with your police department, on a positive level, not to fear, officers, but get to know them, get to understand them. They're there for you, for us.
Yeah.
And they're people too.
Yeah.
Thank you.
Cool. Yeah, of course. Maybe we can get like couple, like maybe like 1 or 2 more comments and then we could move on to the next agenda item. But is there anything anybody else wants to say that hasn't been said yet? I think a lot of us commissioners think the same way, as far as like, we definitely want, more people. It's something that we could help advertise or publicize, that these tours are available to the public, so that they can create that like relationship with the police department on a more personal level. But yeah,
Yeah, I
definitely
think
want
that'd
to
be great.
Yeah. Anybody else? I think Carol, I see you unmuted as well.
One of the things I learned was I didn't realize that Pacifica's 911 is handled in South City, which is kind of interesting actually. And I would think that San Mateo County, I think Pacifica is not San Mateo County, but supposed to be the most expensive place to live in the country, but services, some municipalities can't afford services basic as 911 service. The other thing that I learned too, I was in the military, and so a lot of things that I needed to do my job were provided for, but that's not so with the police department here, like down to their uniform. It comes out of their salary, so it's not like they're making lots of money and with this big attitude. They gotta afford life just like we do. And so I think if more people knew that and realized that, then maybe they would have a different attitude. That's all I gotta say.
Thank you, Carol. Anybody else?
Yeah, if I may, Chair. I just want to kind of circle back with Stephen. That evening we had the tour. You had mentioned, I think someone of close relation to you recently purchased a home in our city. And I want to find out from you if you learned, or if you were able to confirm that there was literature or something that was more or less an invitation to visit the police department. Were you able to follow up on that?
Yeah, it's okay. Well, actually, I was asking a different question. And so if I misunderstood the question, it was to the police department. I did not ask that specifically if they got that. I was asking if they got a welcome to South City kit of sorts. Then basically not to their understanding.
Okay, thank you for the clarification.
Sure.
That's something, while we're on the subject, I think that would be something worth looking into. Just to echo what Carol was saying, these are, our officers are like us. They're human beings. They have lives. They have bills. And unfortunately, there is that stigma about the police department, and we're tasked to kind of help mitigate that. So I think one way would be to just just encourage especially our new community members to immediately get involved, get to know, all the civic departments, not just police, fire, city hall, just everyone, scavenger company. I think it would be, I think it'd be received well by new homeowners, and not just new homeowners. I mean, for existing homeowners as well. So I just thought I'd throw that out there.
Just something I might mention is there is such a thing. There is a Welcome to South City packet, which is a little out of date. So the city's been updating it. And so it's not like something we're handing out today, but Leslie Arroyo, the communications director, is working on that. But something that we haven't done, I don't think, is like, it would be a good idea to run it through the Equity Commission and just have you guys see what you think of it. How does it feel? Is it welcoming and inclusive? So anyway, so there is such a thing. And when we get a new draft, we'll share it with you guys. And then the other thing I would mention is, I think in one of the quarterly newsletters that the city sends out citywide, I know there is an invitation in there like, oh, you're welcome to come and take a tour of the police department, but it could also go in the welcome packet. That would be a good idea, which I don't think. So thank you for that.
If I may add, thank you, Sharon. I didn't realize, and coming from an HR background, it's 101 community building, that first onboarding experience, right, from learning South City all the way on. So great. So we'd love to see what's already floating out there, Sharon. Thank you.
Perfect. All right, last thoughts. Sal, do you want to say anything? No? All right. Yeah, I definitely, it definitely thinks, one of the biggest thoughts that I had was, South San Francisco is definitely unique. I think our services need to be unique to South San Francisco. Something that works, in the rest of the county may not work for our city. So I definitely feel like something needs to be unique to our city. Our city does a lot of good things, and one of the things that I had felt was how I'm just glad these police officers have like a newer building, that they have locker rooms for all people, and definitely found that visiting that, meeting police officers on different shifts even, had really removed any kind of stigma that I may or may not have possibly had. So I definitely think that was a good thing too. Definitely agree with all the rest of commissioners here. And I think that's a really good idea, Sharon. I mean, anything that probably goes out to the public, like if you want the Equity Commission to take a look at it, I think that's a good idea. Yeah. And then Amy, did you want to say anything about that? Definitely wanted to give you that opportunity to say a few words.
Oh, no, I mean, that sounds good. It's cool. We also have Mary Jo on the call, because I know she's been doing a lot of the work of editing that Welcome to SSF book. I'll just say I just took into my notes to look into this, to advertise the tours in the Welcome to SSF book, potentially elsewhere, to see how we can make the residents more available, that these tours are available.
Right, maybe even something that shows like a little bit of the different departments that the police has. Because again, like they do have the officers on the motorcycles, on the bikes, right? Like the ones who are constantly in the community, a lot more engaged than, regular people who might, be in their cars or whatnot. Like definitely putting those faces out there, I think would be good too. People agree with that. Since the public might run into them more often if they're on the streets all the time. And the dogs. I'm always gonna say that. We definitely had
the canine unit.
Yeah, we got to meet was it Taz? Rex? I forget his name already.
Yeah. Adam's companion.
Yeah. So that was really cool. All right. And I do have to say a fun thing. One of the commissioners may or may not have sat down on one of the motorcycles, just saying. All right.
I was fortunate to have that opportunity. If
It's
only
okay.
I could have just turned it on and
Yeah.
rode off into the sunset.
Oh, that would have been nice. They're definitely a lot bigger than I thought. So,
Yeah.
yeah.
I actually thought about you when I saw them. I was like, yeah, she would be like right here.
I did jump on it, I'm not gonna lie. It took me a while to figure out how to get on, but yeah. All right. All right, so I think Mika is here now. I saw Mika come on, Mika Selly. So before we do that, looks like next on the agenda item is a recess, if everybody's okay with that, 6:43. Maybe we'll take like a kind of like a 8-minute recess, come back at 6:55. Is everybody good with that? Yep.
Do you mean 6:50?
Oh, I'm sorry. My math is bad. Yeah, 6:50 works. Thank you, Amy. All right, yeah, so let's come back at 6:50. Oh, let's make sure that our presenter is here. Mika, are you here? Hey. Cool, perfect. So next on the agenda item is a presentation by Mika Selly, who is with San Francisco Police Department, South San Francisco Police Department, and I think the only clinician with South San Francisco Police Department right now. So I'll hand it off to you, Mika.
Thank you. I think Amy is going to share a little bit of it with me in terms of presenting. And Amy, I'm hoping you have the PowerPoint. You can pull it up for us. Beautiful. Okay, so today, my name is Mika. I'm the licensed crisis response clinician with the South San Francisco Police Department, and I'm here to kind of present the Community Wellness and Crisis Response, or CWCRT, team program information.
And I think I was going to do this slide. So we've talked a few times about the previous commission, the Commission on Racial and Social Equity. You all know the things that were in the action plan, and this program was one of them. I just wanted to share that this program, the Community Wellness Crisis Response Team, was really a top program and top priority in the action plan for the previous commission. And they just were hoping for a police mental health response team for mental health and substance use crises, focused on conflict management, de-escalation, and linking people to supportive services.
So, so the CWCRT, it's hard to say the whole thing, and it's hard to say CWCRT. Sometimes I get it, sometimes I don't. The CWCRT pilot program consists of a contract between the county behavioral health, so just the county in general, Star Vista, who is my technical employer, and 4 different police departments. In my case, I am contracted with the South San Francisco Police Department, and there's also a clinician in Daly City's police department, as well as San Mateo and Redwood City. This was an interesting position. I later learned that it was actually difficult to fill this position. In Star Vista, looking for people, they wanted bilingual, but there just wasn't enough. And then they wanted licensed, but even that was hard to find clinicians that fit appropriately, that had the know-how to fit into this position appropriately, whether that be professionalism or specialties or background. And it ended up being 3 licensed clinicians and 1 associate supervised clinician. It's a 2-year pilot program. It kicked off, I want to say November was our official, November of 2021 was our official kickoff, although I didn't start with the police department officially until somewhere in December. And it's the information that we've been collecting in this process is being evaluated by the Gardner Center at Stanford. So they're doing, from my understanding, they're doing a lot of qualitative research around it with some of the quantitative statistics that they're getting, but they've also been interviewing the officers we've been working with. They've interviewed our captains or our direct supervisors connected to the police department, as well as ourselves, and I believe our supervisors at Star Vista. So they've got some interesting insight, both quantitatively and qualitatively. And our job is to assist with cases involving mental health specifically. So often those are suicidal or self-harm or delusional or hallucinations that someone's suffering from.
So the previous commission envisioned some goals and objectives for the program. These include improved outcomes for behavioral health crises, increased access to appropriate resources, increased and improved training and collaboration between behavioral health services, BHRS, and law enforcement staff, and strengthen relationships between law enforcement, behavioral health service providers, and the community. And sorry, I'm trying to change slides. Some of the desired outcomes for the program. The first primary is an effective response to community members in a mental health crisis, but a long-term goal and outcome was also reduced contact between individuals with behavioral health issues and the criminal justice system. Mika, I think this one was back to you unless you'd like me to go through it.
Sorry, I thought I was unmuted. So as far as our protocols go, it's dispatched through 911. So people will call in 911, they'll request a welfare check or maybe a disturbance or whatever the case may be, and it can end up with a mental health component. So in those cases, I would be sent out with dispatch. The officer would get their response on the radio, and then the dispatch would dispatch me as well. Or the officers can request me. So a lot of times, like I said, it may be just a disturbance or sometimes even a car accident or a car or something. And there may be that the officers that are there find that there's a mental health component to whoever's involved, and they can request me. And I can also self-dispatch. So usually I'll have been dispatched by dispatch or requested by an officer, but there are times where I'll self-dispatch if I am familiar with the person that the officer is working with, even if it's not 100% mental health related in that moment, just simply for the rapport that I've built with them. It's helpful to kind of bridge that gap. So sometimes I'll self-dispatch as well. The officers are always first on the scene. So although I go with them, they are on scene first, and I'm kind of staged a little bit back so that they can clear the scene and make sure it's safe for me. And then when they say it is safe, whether that means they've searched the person or kind of looked around the house, or they've exited the house, or they're cuffed, or whatever the case may be to deem safe, then I can come in and provide de-escalation and support services. A lot of times it's support services can include resources for loved ones and for the client as well. But a lot of times someone in a mental health crisis isn't in a place to take those resources at the time. And so I can give them to loved ones, family members, neighbors, anyone who's able to support the particular person or citizen at that time. And de-escalation is in part when they're too disrupted by their mental health symptoms a lot of times, and it's difficult to communicate for the officer or for anyone else without the mental health background. And so I could be helpful and come in and know how to approach delusions or hallucinations, or maybe be familiar with that person or their history, and I can kind of de-escalate the situation enough to manage the original call, whether it was their safety or a disturbance or a neighbor bothersome or a car accident or whatever the case started. I can do some de-escalation to help serve the original problem. One of those things could be a 5150 hold. That is the recommendation for a 72-hour evaluation at, we use Mills Peninsula Hospital here because it needs to be, that's our contract. The closest psychiatric hospital is Mills Peninsula from South San Francisco. And so if they're put on a hold, our fire department can transfer them to Mills Peninsula under my recommendation of the 5150 hold, although officers can write it as well. And, or like I mentioned, it could just be referrals for treatment, or maybe just sitting with them and making that call to get set up for services for the first time, or to get on Medi-Cal, or to connect with a therapist, or, you know, be the bridge person, and maybe sit there and make that call with them right there. All of those things are different kinds of support or referrals I can do. And then I also try to do at least one follow-up or case management call. So what that means is a day or two, depending on what the situation was. After meeting the client, I try to give them a call or sometimes meet them somewhere if they don't have a phone. That's a lot harder to work out, but usually a call or an email communication to see how things are going, to see if they were able to connect to whatever resources I gave. If there was a safety plan done, which is another de-escalation tactic that could have been done. A safety plan is basically, we don't like to say contract, but essentially it's a contract for safety. And it's just a form for them to figure out what their coping skills are, what their triggers are, what other people can do for them, who they can reach out to. Kind of like just a little safety net so that it's more easily accessible to them. And so if I were to do that, then the case management or follow-up may include discussion of the safety plan. Did it work? Were you able to follow it? Do you want to change it? Did you share it with anyone? Things like that is the one follow-up call is pretty, it's an important part, I think. And it's meant to be short-term. I'm not meant to be a case manager. So that's why we say one follow-up call. And I call it crisis and connect. I manage the crisis and then connect them with a resource. So my case management, that follow-up is very limited, unless needed. There are cases that I've been working with for months now. It just depends on the situation, but I try to get in at least one follow-up. And for program details, so currently my hours are Monday, Wednesday, Thursday, Friday, 9 to 5, and Tuesdays are 10 to 6. So that's not 100% accurate there, but mostly those are my hours. More often than not, those are the hours. Uniform is just plain clothes. I have a long sleeve gray shirt on, polo. That's our average uniform. It says Star Vista in it, and then on the back it says community crisis clinician team or something along those lines. Although my colleagues in other cities and myself at times find it easier to wear maybe something more professional to help the client connect with us a little bit more. We're clearly distinguished from the officers in what we're wearing, but sometimes we might wear something, or you might not see our long sleeve shirt because South City's cold and you can't just use one long sleeve shirt. So we may be dressed a little over that, but for the most part, just basic plain clothes, clearly distinguishing us from officers. And then a little bit about me. I was raised here in South City, and I'm a graduate of South San Francisco High School. But if you went to El Camino and you're from here, that's okay too. I forgive you. Technically, I lived in El Camino territory, so I kind of have to support both. But yeah, I was raised here in South City and graduated South City High. I played varsity softball for 4 years. That was my one of my two highlights of high school were varsity softball, something I was good at, and physical activity. And then there was Sojourn to the Past. I don't know how many of you are familiar with that program. Nonprofit civil rights education program, taking students and now teachers and adults and officers. I think all of San Francisco's officers have actually taken the trip, or that's the goal, to the South, Georgia, Alabama, Mississippi, Arkansas, Tennessee, to study the civil rights movement and meet veterans and see museums and memorials and things, along with a lot of reflection for the students to figure out, to help them figure out where their place is in the world. So while in high school, I did Sojourn to the Past for 2 years. The first year I was a student myself. And the second year I was a student teacher. And now I've been working on and off / volunteering with Sojourn ever since. So I'm pretty well connected to that program. And that's a very strong part of my identity for me. I think I really enjoy the civil rights, the education, the equality and justice piece. I love being a part of that somehow, with or without my job. And I got my bachelor's of social work from Concordia University in Portland. Sadly, it has since closed and been taken over by the Ducks, Portland School, the Ducks, or Oregon Ducks. So sorry if you're not a fan, or you are a fan and I'm not super excited, but in any case, it used to be, we were Cavaliers in Portland, Oregon. And then I got my master's degree also in social work, with an emphasis of mental health through University of Southern California. And that allowed me to do or continue to be trained in things like community organization, advocacy, grant writing, different areas of all of life, quite frankly, and social services, but with the caveat of specializing in mental health. So I had extra courses in that, and that's what made me eligible to become a licensed clinical social worker, which is right there. I also specialize in eating disorders and suicide prevention intervention. So that fits, at least the suicide prevention intervention part fits really nicely with this job. We do run across eating disorders or disordered eating that are often comorbid with depression or anxiety. So that fits in nicely as well. But those are two things that I've made a point to further educate myself and connect with and work in those fields. And in terms of going into this field as a licensed clinical social worker, which is the same extent as a marriage family therapist, I'm licensed and can do the same things. I was inspired by personal experience and Minnie Jean Brown Trickey. I don't know how many, if any, are familiar with that, but she was one of the Little Rock Nine, the first 9 students to desegregate Little Rock Central High School in 1957. And I met her through Sojourn to the Past. She works there, and she's been a great mentor for me, very inspired me and introduced me to the field of social work, because I didn't know that was a thing. And she gave me a name for all of the things that I love. And I've been working as a clinical mental health for about 8 years. So that's since I got my master's degree, but I've been doing more general mental health since I started undergrad, or even longer, but technically clinically for about 8 years. And from what you may have gathered, I'm really into the social justice and civil rights scene, equality, things like that, taken from Sojourn to the Past, I think, and given me a voice. And now sometimes it gets me into a little bit of trouble, but I like to speak up and speak for injustice and equality and civil rights. And sometimes that's in the field that's advocating for my clients or my patients or they're citizens of the city, or whatever term you'd like to give it. I get to do that in advocating for their treatment and their care. And I've also been doing suicide prevention intervention on the Golden Gate Bridge for about 11 years. So I also support an organization called Bridge Watch Angels. And on a lot of major holidays, we'll do trainings for anyone willing to volunteer, usually 70 to 100 people. And we'll do trainings on what to look for suicide prevention intervention and kind of separate people on the bridge. So just look for that, to say hi, to see what we can do to prevent or intervene with any kinds of suicide. And then I myself go out with another facilitator or just with family or any friend that I can talk into walking through the cold San Francisco Golden Gate Bridge for hours. And we do our own suicide prevention intervention up there. And these are some examples of situations. These are stories with clients, basically. So nicknames is, I was named Pocahontas, I believe is what the client called me. I worked with him de-escalating a major scene, I think 1 week, and then 2 or 3 weeks later, we had another incident with him, and he wasn't responding to anyone. He wasn't talking to anyone. He wouldn't leave the house. And we were having difficulty getting through to him, but I was making calls and talking to him, and he remembered me, and we slowly got all the way out of the house and was able to speak with me. And he called me his Pocahontas. And I think it's funny because he actually brought me a Granny Smith apple. So I felt a little bit more like Sleeping Beauty or Snow White or something, but he called me Pocahontas. And so I get little nicknames that the officers like to keep for extended periods of time and then call me by based on what the clients say for me. I've also worked with middle school memories. So I've worked with kids that adults now that I grew up with who have had kids, and I've been able to help them and reconnect with people that I grew up here in South City because of working with their children. Generally, that's been in middle school. And just having that connection to the community is really helpful. I mean, I know that's a personal connection, not necessarily professional, but it's a nice part about being here in South San Francisco is that I have the opportunity for personal connections like that, be it via my history or just the fact that I know the area for the most part. And the outsider, honestly, I don't remember what that was supposed to cue me for, but it was another example of just kind of the way that this program, I think, has benefited in our community, how I fit into this program, and a lot of the the outcomes, the positive outcomes that it can lead to. Like I said, that rapport with the person who named me Pocahontas and the middle school, as good or not good as they may have been memories, and just being with others in the community. So those have been some really beneficial and I think moving times for myself, and hopefully beneficial for the clients and helpful to them in getting what they need. This is for Amy. Oh wait, was it for you or was it for me? I apologize.
We can do either way, whichever you prefer.
Go for it. You put it together. My apologies.
No problem, no problem. So in the research creating this program, and since the city's looked at a couple of different models in other cities, as Mika had mentioned, this program in South City is currently a pilot program for 2 years. And so there's a conversation of after the 2 years, what happens next? Do we continue on? Do we make changes? So just knowing what some other cities are doing is kind of helpful to help think about what we want to adopt in South City. So some of the other examples, there's the Cahoots program. You've probably maybe have heard of it. It's been really well known since 2020. It's been a part of the national conversation as a prime example. They've been working for decades. They're a separate team from the police, and they send a medic and a crisis worker to calls. I think they can be dispatched through 911 or you can call a separate number, and they're a 24/7 operation. In San Francisco, there's a couple different teams. We have two here. One is the San Francisco Street Crisis Response Team. They send out a paramedic, a mental health clinician, and a peer specialist. They're also a 24/7 operation. They have 6 teams around the city. Each team can respond anywhere in the city, but they found that locating the teams in particular neighborhoods helps them build community in those neighborhoods. Obviously, that's probably a lot bigger than something we do in South San Francisco, but it's an interesting model. And I think they staggered their teams. They didn't start their overnight operation until one of the last phases of implementation.
They just started the overnight this past year.
Thank you. We also have the San Francisco Department of Public Health Comprehensive Crisis Services, which is where our chair, Cancino, works. She's part of this team. So she helped with the details here. She explained that crisis clinicians are sent out in a team of 2. There's also an officer and psychiatrist available for consultation while they're in the field. Sometimes police will ask to respond with the crisis intervention trained police officers. So the crisis clinicians go out with the CIT trained police officers. This is also a 24/7 operation. And I'm sure we could ask Crystal for a lot more detail on that one as well. Half Moon Bay has a CARES program, which sends an emergency medical technician and a behavioral health professional. They are currently 7 days a week, but only 8 a.m. to 6:30. So more similar to our current schedule. And then the city of Alameda has a team that sends a paramedic and an EMT who have access to a clinician while they're in the field. That's housed in the fire department, and they co-respond with police. The police go to the scene as well, and that's a 24/7 operation. Okay, I think there was a video that was requested to share. Let me know if y'all can hear this when it starts. Can you hear? Thumbs up, thumbs down? I'm looking at the chair.
Yep.
Okay, cool, thank you.
Yeah, we can hear it.
Mental health awareness is not only an important concern in the community, but for all of us here at the South San Francisco Police Department. As a result, I'd like to take this time to showcase 2 of our specialized positions in our organization. The first one being our community outreach team, and the second one being our clinician.
I'm Stephanie Tenorio. I'm an officer with the City of South San Francisco. I've been an officer for approximately 3 years. I was trained in crisis intervention training early on, along with most of our officers. I have also participated in several panels with the crisis intervention training, and I'm currently assigned to the community outreach team.
Hello, my name is Cwcrt. I've been a police officer with the City of South San Francisco for approximately 22 years. I've attended crisis intervention training. I'm a field training officer and a police defensive tactics instructor, and I'm assigned to the community outreach team.
Hi, my name is Mika Chelly. I'm a licensed clinical social worker. I have specialized in crisis counseling intervention for about 12 years, and I've been doing mental health as a whole for about 8 years. I'm currently the community wellness crisis response team clinician, and I'm working with the South San Francisco Police Department.
The community outreach team has built relationships with outside agencies such as Street Medicine, Telecare, Caminar, and Life Moves, as well as other agencies. As a last resort, when a police officer believes that a person is suffering a mental health crisis and they're a danger to themselves or to someone else or gravely disabled, they can get that person treatment at a mental health facility.
In order to effectively help those with mental illnesses with a long-term solution, the community outreach team, along with our clinician, collaborate with several agencies that focus on mental health services to seek further resources.
If the community outreach team is working, we'll respond to calls for service.
If the community outreach team is not working at the time, the patrol officers will follow up with the team and we will work with our clinician to see how we can assist the individual, their families, and the patrol officers on how to seek further assistance.
As the crisis clinician here with the South San Francisco Police Department, it's a new and unique program. After situations de-escalated, ideally we can do a safety plan. And what that is me working with the client or citizen to find a sort of a contract, a middle ground until we're able to connect them to full-time resources or long-term resources. So we just work together to find triggers, to find warning signs, find coping skills, things that could help when they do re-experience a crisis. So after de-escalation and safety plan is the follow-up. And that generally was in the next couple of days, depending on how much treatment or where the client ended up. But I can also follow up with families. So if we're on the scene and the crisis happens, but it's relieved and officers can leave, I can stay and support families and offer resources and help them connect to things that would help not just their loved one, but themselves as well. With the community outreach team, I have the opportunity to provide connections to housing resources, food resources, medicine, connecting to medical teams, mental health teams, substance abuse. One of the ways that I can kind of access and support people, aside from the follow-up, is with the Star Vista connection. It helps me already know resources out there, already know a lot of common medical providers or therapists, psychiatrists. And so it's easier for me to connect the client with them after the crisis and make sure that is followed up on and long-term care is continued. Having grown up in South City myself, I am honored to be in this new position that's just started and to help lead the way for a program like this. Something I've always wanted to do mental health work and contribute to the community, and this brings it to a whole new level.
If you or anyone you know is in crisis, please call 911 or call the new suicide prevention hotline at 988.
Okay, I think that was the end of the slideshow. The last slide just says open for questions.
Cool. Thank you, Amy. Thank you, Mika. Thank you so much for your presentation and working out of your regular hours. I really appreciate you working such a long day. So, and just putting the presentation together. Just wanted to say that first. So did anybody have any questions for Mika? Stephen, looks like you're unmuted. Yeah, go ahead.
Yes, hi, and thank you. Yeah, as Crystal just shared, thank you, Mika, for sharing more of you for us tonight. And in terms of, if you can help me understand, I was just curious because obviously there's a lot of different situations here, and I have two questions. My understanding, as you just shared, is just one of you in your capacity, in your role, right? So, and then obviously you can and I'm sorry if I'm not getting the lingo correct way, but you can self-call yourself, or the police, or the police can call you. What if you're not to me, a resource is a resource is a resource. So even if you're not physically there, how can you still be there if that's an option, like digitally, phone? What conversations around that?
Yeah, sometimes I'm available by phone if I'm maybe I'm on shift, but I'm on one scene and a second scene starts and I'm maybe not there yet. Officers often call and we can consult. We usually offer the client if they'd like to speak with me over phone, especially if it's one where the officers are requesting me. A lot of times the clients don't like that as much. So they'd rather say, no, I don't want to talk to anyone. I'll just talk to you, or I'll wait for her. But I am available by phone for different consultations if it appears that I might not need to go out, or if perhaps the client needs more support, doesn't know where to get it, and just talking to the officer, like, I'm just I don't know, just everything's feeling out of control. I've tried to get help, but I can't. If it's just like appears to be a minor stress need, but the officer may call and say, hey, this is their information, or can I give them your information, so you can kind of work on resources, and I do that as well.
Oh, that's great. That's great. And boy, that's a tough balance, and that's great to know. That there's options. Of course, ideally to be in person. It's nothing beats the in-person moment. So that's highly valued. So thank you. And my second question is on a similar level, because with different people that you're interacting with, and with the changing demographics of our city, how quickly or how easily does translation services come into play for those of very different language kind of positionings?
Yeah, that depends a little bit on what the language is. Hopefully, for Spanish speaking, we have an officer available that speaks Spanish, or maybe we could hold the case a little bit if it doesn't seem like extremely detrimental to the client. Maybe hold it a little bit until that officer is available. But we also have the language line that the officers also use, where we can call in verbally and speak with them, tell them what we're, kind of what the situation is and what we'd like them to tell the client, and then put them on speakerphone and they can talk to the client. We can go back and forth that way. I also have an iPad that I can bring with me for those hard of hearing or deaf, and we can use a video translator for sign language as well.
Okay, thank you for clarifying. I didn't realize if you had a special dedicated kind of line, because it's a different type of conversation versus using the resources to police. So I appreciate that clarification. But in and of itself, glad that that's an option there as well.
I have a brief question. Well, actually, I have 3 questions, but they're all about the same thing. So I'll just spit them out to you all at the same time. This may also be a question for staff who may know, but I'm interested in this data use agreement and this partnership with the Gardner Center. I was wondering, one, if where we might be able to find that. 2, what I saw the slide on the desired outcomes, but I was wondering if there are predefined measurable outcomes that the Gardner Center is looking at. And also 3, whether the extension of the pilot is conditional on the findings or analysis by the Gardner Center.
So for questions 1 and 2, I'm going to redirect you to Captain Adam Plank. He's the liaison kind of between myself and Star Vista and the county, because he would know a little bit more, I think, about the Gardner Center. And question 3, as far as does the pilot program depend on those statistics and stuff? It does not. I know that Star Vista is looking at it and kind of considering, is this something they want to keep, or will they make their own changes, or that sort of thing. But I don't believe it's conditional on any results that come from the Gardner Center.
Thank you. So regarding the data use agreement, in the beginning, the Gardner Center, along with the representatives from each of the different agencies in this pilot program, really put together what the expected outcomes of the program, what we anticipate might be the results of how the program goes. But we really are looking forward to, as the program continues to develop, how that data actually shapes itself and shows us how it's working, as opposed to what may have hoped. I'm expecting there to be some variances in some pleasant surprises, and then some areas that maybe would need some fine tuning or some adjustment to reach what we expected or what we hoped for of the program. And regarding that, I think, Amy, correct me if I'm wrong, but further along in the clinician presentation at later dates, we will be discussing the data and the Gardner Center's role in the process in much more detail.
Yeah, to that point, I'll share city leadership requested that we start with an introduction to the clinician, which is what we had today. Meeting 2 to share some of that data from the Gardner Center and that the PD have been collecting internally. And number 3, to chat a little bit about what's next and to get everyone's input on what should be next. But definitely please keep asking these questions. These are great.
So I have a question about that as well. Do we have somebody in South San Francisco who is doing a needs assessment? And if we do have somebody who's doing a needs assessment in South San Francisco, do they have access to that data from the Gardner Center to help match those two as far as build the things that, again, South San Francisco specifically needs versus countywide? And again, this is the data that they're evaluating or looking at. It's just South San Francisco specific, right? Not all of county.
The Gardner Center will be looking at each of the 4 cities, but then also, obviously we can have our own little bubble of our statistics. And then we're also collecting data ourselves here in South City via an app to help monitor traits and commonalities and things like that we may be able to better help in the future or anticipate.
Oh, thanks, Mika. So if South San Francisco does have somebody who's doing a needs assessment, can they have access to that?
So what do you mean by needs assessment exactly?
Meaning, and again, like this is definitely, I don't know if I'm asking this question a little too soon, but one of the questions that I have for you is when you're doing these referrals and you're referring these families, kids, adults, where are you referring them to? If this is like a county, a county-led project, right? It's from county, but it's here also in San Francisco as one of the pilot programs. Where are our resources in South San Francisco? So like the clinics that you might be referring them to.
Gotcha.
Yeah.
Yeah, I carry a few different packets, one geared toward mental health resources, one geared substances, one for homelessness, one for trauma, and one for just general resources. And essentially I don't know if you've seen we have a little booklet in South City that has a bunch of resources listed. So I've taken from that as well as anything I know of on the side, whether it be volunteer, Medi-Cal, or community-based, or things like that. And I filed them each in my little packets. And then if I remember correctly, Amy actually has each of those packets available online. Is that right?
That's been a back burner project, so they're not up yet because there's a few different pages that kind of merge together, but I do have them, and yes, would like to put them online.
So I guess, so as far as like the needs assessment, it's more so of when we're making these referrals to families and to children and stuff, how many of those services are in South San Francisco specific versus being outside of South San Francisco? And if there is like a huge need, let's just say, like, for instance, if a family or a child needs some kind of outpatient mental health, and correct me if I'm wrong, Amy or Sharon, but we don't necessarily have a child-specific clinic in South San Francisco. Is that correct? That's South San Francisco funded.
No.
Right. So
no, but we do have the county health clinic at the corner of Grand and Spruce offers services for children. They have a pediatrician and county health pediatrician there.
Right.
I'm sorry, maybe was that your question?
It is, but I feel like that's only primary care. It's not actually, right? It's not actually mental health or psychiatric services. So a child in South San Francisco actually wouldn't be able to get a psychiatrist in South San Francisco. Am I correct?
I'm not sure about that.
Okay. But that's basically like talking to the point of like having a needs assessment in South San Francisco, taking that data and seeing what can we build in-house versus having to use either county resources or outside of South San Francisco, because sometimes that can be difficult for our families. So that's the question I was wondering is, if we have somebody to do a needs assessment, and can they use that data to figure out what it is that South San Francisco needs, since we're starting to build or wanting to build or have intentions on building something South San Francisco specific. Does that make sense?
Yes.
Cool.
I haven't looked or compared specifically which are in South San Francisco versus county or outside of San Francisco, South San Francisco. I have not included all of the county things in my handouts because I recognize South County, it's really not an option for a lot of our clients. So I've really only included the things, maybe Millbrae, Burlingame, and up towards us to Daly City. As far as specific mental health treatment, I don't think South City has its own available. I think that off the top of my head, there's county mental health, and that's located in Daly City, but that's for all of Northern County. And then in terms of outside of Medi-Cal, as far as I know, we only have like private therapists or organizations that can offer services, and even private therapists can. I don't know if there's a lot of organizations within South San Francisco, but I'd be happy to take a look at that for you.
Mika, I know at one time the school district had some referral. They had counselors, mental health counselors, or they used Star Vista. I don't know if they still do.
Yeah, okay, so that's true. For students in particular, Star Vista, my agency, is contracted with the school to some extent, and there is a school-based counselor. I'm not sure about all the schools or which schools. I know that South San Francisco High School has a school-based counselor that sees maybe 5 or 6 students on a regular basis. So I think that might be the extent of intensive mental health services. And I think there are therapists with the county that can come into the schools in South San Francisco, but that is not organized by us in South San Francisco. That's organized by a larger entity outside providing services inside. Does that answer the question?
It's definitely raised more questions. Out of all the call, and again, like, yeah, I mean, of course, we're gonna get the data next month, but I didn't hear anything about substance use yet. And I know, like, substance, sometimes mental health and substance use goes hand in hand. Do you have resources for people with substance use who you come by?
Yeah, one of the packets, like I said, that I carry with a list of resources is specific to substance abuse programs, whether that's outpatient, inpatient, residential, Medi-Cal, private pay, insurance. I have a specific list for that. It's not a huge part of this pilot program in particular. This is geared more specifically to just crisis mental health in the moment. So like I said, with my personal mottos, kind of crisis and connect. So I deal with the crisis and then immediately connect them to someone else who can take it long term.
Right.
There's not really a substance-based approach to that. If it comes up, which it usually does with mental health, or maybe the call is for disturbance, drunk in public or something. And the officers may go out there and find, oh, I don't know if this is mental health or if this guy's really drunk or high or whatever. And so I could go out and maybe try to do an assessment. And if we think it's substance abuse, or if the family says it's substance abuse, I'm happy to provide the list of resources I have for that. But this particular position within this pilot program is not aimed directly at substance abuse treatment.
And for all the calls that you go out on, do you, is dispatch or the officers or even yourself, do you guys ever try to triage the calls versus having to respond to like every single call that might come through?
I think to some extent, yeah. I know that our sergeants can, they can like overrule a call or rearrange some stuff. I'm not sure. Adam may be able to speak a little more specifically, but I know that dispatch kind of triages from a very general form, and then the officers may be able to do more specific, or I'm not sure if I'm able to answer that. Maybe that's an Adam thing.
I'll give it a try. So luckily in South San Francisco, we don't experience high volumes of calls where Mika would be stretched in 6 different directions, all at the same time. Like she had mentioned in one of her examples, there are times where maybe 2 calls, officers are being dispatched to 2 separate calls at the same time, and the phone communication comes into play on those if the officers have questions. I know that the patrol sergeants regularly stay in contact with Mika on certain specific details of calls that maybe the officers went on that maybe she wasn't available to get feedback on. So I think the communication helps a lot. And as far as triaging, I can't think of a time where we had so many behavioral health calls at the same time that we had to pick one and start working our way down to the lower priority calls. Not to say that more than one doesn't come up at the same time, but we're fortunate in South San Francisco to have manageable call volumes as it relates to mental health. Yeah.
It looks like Sal has a question.
So I would just, I had a question around the volume of maybe of calls since the pandemic has the onset of the pandemic in the Old Town, downtown area. I do see a lot of activity. I do see a lot of police presence and more homeless and transients, as the train station opens. So I was just curious, if Mika is being present at those calls you're getting.
Sorry, can you phrase that one more time? I'm not sure that I completely caught it.
It's just I see, since the pandemic has started, I see a lot of homeless and I think like transient population in the downtown area. I see a lot of heavy police presence, a lot of flashing lights, 2 or 3 cop cars for one person. And just, was wondering how, if you're being called on the scene and for these, for the population.
Yeah, so mostly our CWcrt, our community outreach team, which was the other 2 officers focused on in that video, they do most of the homelessness stuff, particularly if we know it's homelessness. If it turns out that we didn't know that and I get there and that is an aspect, then I can certainly provide that referral, whether it be having the CWcrt community outreach officer reach out to them, or Life Moves is a program that works into getting housing, either short-term or long-term eventually, with a lot of our citizens here in South City. But again, my program within this particular pilot program is focused primarily on crisis mental health. So those aren't calls I'm generally called out to. A lot of homelessness does have mental health component. And so the CWcrt officers can call me and ask me for referrals as well. That happens pretty frequently, but I don't generally go directly to houses related to homelessness, calls related to homelessness. Does that answer your question?
Yes.
I think we have one more person who has their hands up, Sharon. But if I can just kind of go back to Adam Plank with you responding to the question about triaging. As far as like prioritizing, because I heard you had said that, I'm assuming youth minors are probably highest priority unless there's some kind of like public safety thing going on, somebody with a weapon. I wanted to know how you prioritize your mental health calls.
So prioritizing calls in general?
Specifically the mental health ones, you don't have to go through
Okay.
which one's A and B and what, you don't have to do that, but just like, as far as the mental health calls, you know, somebody who, an adult who's suicidal, somebody over here with a weapon who also is, you know, is experiencing some kind of, you know, the episode of psychosis, and then maybe a child who is at school feeling suicidal as well, or homicidal or out of control. Like, how do you prioritize those calls?
So as the calls come in, and if it's related to something in Mika's scope, she will immediately be dispatched to that call that meets her expertise. If while she's either en route to that call, or if while she's on that call, depending on whatever the details are, if something more pressing, more immediate were to come up, and like I said, I don't believe this has ever happened before, and Mika, correct me if I'm wrong, but I would comfortably say that she could be pulled from whatever lower level call she's on and be rerouted to the higher priority call without any kind of issue or roadblocks in the way. One thing about this pilot program is the word crisis involves, you know, something abnormal happening to someone out of the ordinary, and immediate help is needed. If the situation involves someone who is actively armed or posing a danger that would prevent Mika from initially making contact, she's staging and she's waiting until the scene becomes safe for her to go and make contact. So if there was an active situation that is not quite safe for her to go to, as it happened today during day shift, she would stage nearby, remain available for calls, and wait for that scene to become secure before she made contact. I hope that answers the question. It's difficult because we don't have, you know, the number of calls that much larger cities have that are pulling Mika in so many different ways that it's unmanageable. I believe from talking to her and keeping an eye on the calls that come through our dispatch center, that she's able to address the needs of the community during her work hours without leaving certain calls or certain individuals in their circumstances kind of on their own.
I would just add to that. I mean, I think that's 100% accurate. And I go into it with the mindset of thinking these cases that they would like my assistance, or at least when the officers are requested, generally implies a certain level of acuity in mental health symptoms, particularly delusions or hallucinations. And so when I go on a call, if I hear another welfare check for someone, maybe they don't have those symptoms, but they might have some suicidal ideation or whatever, I keep in mind too that the officers are crisis intervention trained, and that some cases we know for a fact are going to lead to a 5150, whether I write it or an officer writes it. And so for me, at least, that kind of helps me in my brain balance in the off chance that there is more than one call kind of going on at the same time, just being mindful that, you know, ideally I could be there in person, but there is also the phone, like Adam said, there's staging, and there are cases where we just already know it's going to be a 5150, and an officer can do that if it's safe.
Makes sense. Thanks, Mika. And then Carol, I believe you had your hand up.
Yes, thank you. Thank you, Mika and Adam, for all the information. I have two questions around the data that's collected. Number one, what is that data and that you collect? And this is data that Gardner will be looking at. The other question is around so the first response as a cop, is there any experiments or data collected around what could trigger that person, right? So showing up in a cop showing up in uniform might be more triggering than, let's say, you showing up, or a cop showing up but not in a uniform, or in like your attire.
I think sometimes we're able to become aware of that ahead of time, and sometimes we're not. I know that in my experience, particularly calls involving juveniles, whoever's making the call will often say, oh, you know, they have a bad experience with officers, or they might be scared of them, or they're so young that they're, you know, some variation of that. And we can sort of accommodate. I can talk to the officers, you know, before we officially go in, like, hey, you know, kind of, as long as it's safe, which I guess this is more in regards to school environments or like care programs for adolescents and youth. There's other staff around, this client, this youth doesn't have a knife in their hand or something of that nature, then it's easier for us to kind of slow the roll a little on the officers in the introduction. And also, I think one of the ways is, again, if we know that it's not an immediate threat with a knife or a gun or something like that, sometimes I can stage, like, not in my car, but a little closer, and the officer can, you know, knock on the door, say what they're doing, and I say, oh, don't worry, they're here for me. Like, and then, you know, as soon as they say it's safe, I'm, oh, you guys can back away now. Like, they just have to be here for me. Like, it has nothing to do with you. And I try to emphasize that for whoever it is, that, like, you know, that's not the reason that they're here. I'm the reason that we are here. And with adolescents, again, in particular, in a school or other kind of program environment, oftentimes the officers can leave because there's a good amount of other supervision and able to contain the situation. And I can say, no, officer, just go ahead and find the next call. There's also, in our particular pilot program, I have access to some medical records, not a lot, but other county programs or county organizations sometimes use the same medical record system. And when there's time, or if we have the information ahead of time, I can look them up and see if there's anything there. And if there is a history of something related to anything that may be more triggering regarding law enforcement, then I can at least give the officers a heads up. You know, it would never be me at the door first, but we can kind of plan a way to make it a little more smooth, or not to say lighthearted, but almost lighthearted with the situation, so we can transition from them to me.
Thanks.
And I think I can touch on the first question that you had. So some of the items that we're reviewing and collecting is the total number of calls that result in a mental health evaluation hold, where the person is transported to a medical facility. We look at the day of the week that the call came in, the time of the day, and that's to give us a good gauge of, hey, is our schedule that Mika's working having the most impact on the community. We look at the specific details of the individuals who are contacted, if they are housed or homeless, if they live in South San Francisco, if they don't, in San Mateo County, We also differentiate if they're within the county or if they're outside of the county. We look at age range. We look at race and ethnicity. And then we've also have been tracking the top 10 calls that require MICA's presence, and also the top 10 outcomes, or I want to say services, but what MICA did on the call, what those top 10 items are, and how, as time goes by, they, certain categories are going to continually rise, and we'll know which ones are the most, are being used the most and potentially have the most impact during these calls. The Gardner Center is, they're professionals on data analysis, and I would look silly if I tried to explain everything that they are looking for and collecting. However, I can give you a brief snapshot. They're looking at data prior to the program starting to establish kind of a baseline, or where were we before this 2-year pilot program, and then they are continually assessing the data at different stages of the pilot program to look for, like we talked about earlier, trends, unexpected highs, unexpected lows, give us direction on maybe, hey, what we thought was a good idea and a good setup needs some tweaking to make sure that we're as effective as possible. And I'm hoping that in one of the next 2 meetings, someone representative from the Gardner Center will accompany me on the meeting and be able to give a much more intelligent description of that than I just did.
Yeah, thank you. That was good. Thank you.
Arnell, I saw your hand up earlier. You took it back down. Just wanted to.
Oh, thank you, Chair. No, Captain Plex, sir, he addressed it, so I'm good. Thank you.
All right. Just kind of like considering time, it is 8 o'clock. I think since we're going to be meeting with MICA is going to be on our meetings for the next couple months, I think maybe we could save questions for those times, so we don't keep her so much longer. I do want to say I had the privilege of meeting MICA last week. Is it okay to say this? Is it okay to? Yeah. Her and I did respond to South San Francisco High School, providing psychological first aid and mental health relief for the students and for staff. So definitely got to see her work in first person, which was awesome, and super, super happy that she's with South San Francisco and providing this service to our citizens. So really happy she's here, really happy with the presentation. And thank you again, Captain Plank and Chief Campbell, for being here to support the presentation and answer questions. Appreciate that. Anything else? Amy, Sharon, Mary Jo, commissioners? No?
No, I mean, just excited to start this journey of looking at this program and seeing if we can add to it.
Yeah, definitely adding to it. I mean, I just know firsthand working in crisis in San Francisco, having a partner who's also another clinician is very helpful, to have somebody bounce ideas off of, and just making sure that you're, dotting your I's, crossing your T's. So I think if anything, MICA might need a partner, maybe if this is even something that needs to be 24/7 at some point. But I do know, and you could put this in, the analysis or whatnot, maybe if South San Francisco has the same trend, full moon days is nuts for us in San Francisco. So, and it's across the board, right? It's like children, it's adults, it's substance use, it's everything. So maybe MICA needs OT around those days or something. All right. Okay, yeah. I think with that, thank you again. And I think maybe we can move on. If Captain Plank, Mika, Chief Campbell, if you guys have any last words, we'll move on to the next line item.
I don't. Thank you for having us.
Yeah, absolutely.
Yeah, I just say thanks for having us and, you know, kind of listening to what this is. And I look forward to hearing your guys' input just as much to see what we can develop this into or grow this into. And OT, you can mention that to my other supervisor, not Adam, but and yes, full moons are teaching, it's healthcare, it's everything. Full moons, I completely agree. But thank you for giving us the time to just present and speak here for you today.
Yeah. Thank you.
I just wanted to take a moment to welcome Commissioner Yee and Commissioner Delgadillo. I'm the Chief of Police, Scott Campbell. Looking forward to getting to know both of you and hearing your ideas and recommendations going forward, and whatever we could do to better serve our diverse South City community. We're all in. So thank you for being here. Congratulations on your appointments.
Thank you.
Thank you, Chief Campbell. All right. I think with that, we can probably move on. I think we don't have too much left. Do we, Amy?
Yeah, just two more small things.
Okay.
But feel free to table one if you want. Yeah.
Yeah, I think we can table the talk about the commission retreat. We still have some time to do that. And then the discussion and potential action on holding November and December 2022 meetings. So I think with that, yeah, we can start with that just because that's coming up.
Sounds good. So basically, speaking with internal staff, a lot of boards and commissions will not have a regular November and December meeting just because of Thanksgiving and other holidays. So if you all would like, you can change the meeting schedule. You could either meet as scheduled in November and December. I don't remember the exact dates, but we're always the third Monday of the month. You could cancel one of the other meetings. You could cancel both of the meetings and instead have a special meeting between the two, maybe like first or second week of December. Or you could cancel both of the meetings if you wanted to. And the only fiscal impact would be if a meeting's canceled, the stipends don't get paid for that meeting. So up to you all what you would like to do for November, December, if you want to discuss, and then at the end we can perhaps take a vote if someone wants to make a motion.
I just want to clarify though that Mika PD are going to be continuing on with presentations, right, for the next couple months. So if we're canceling that, then we're actually postponing that until however long. I mean, if we cancel versus reschedule, right?
Yeah, we haven't talked about the exact dates, but yes, they are planning to come back at least 2 more meetings.
Okay. Yeah. Does anybody have any thoughts or ideas about that?
Just briefly, I just noticed third Monday's December 19th, and I'm not very savvy with it, but it looks like Hanukkah's that day. Is that going to be tricky?
I mean, it could be. Does anybody want to, I mean, that's something we could definitely think about. Does anybody have any ideas about maybe changing the dates for our December meeting? It is on the 19th.
I think in general, I'm in favor of, I think it's the third option, which is holding a special meeting in early December and canceling the other 2 meetings. I think that, to me at least, seems like a good middle ground.
I agree with Alan as well on that one.
Having one meeting in between November and December, is that right? I just wanted to
Yeah.
make sure it was clear.
So canceling November and having a special meeting in December.
Could Mika come at a special meeting and present? or Captain Plank or someone from the police department present, or from the Gardner Center? I'm just curious with regards to a special meeting, if information can be shared with us.
I think it would work for us as long as we had enough notice to give the representatives from the Gardner Center. They seemed fairly flexible with the meeting time and date. I did tell them that I would get back to them on what date, exact date it would be needed. So.
Commissioner Junio, if you're asking if a special meeting is any different than a regular meeting, it really isn't. It's just we have to call it that because it's not on the regular recurrence, but anything you do at a regular meeting, you can do at a special meeting. And then I would also just add, I do think it would be good to avoid Hanukkah for sure. Even if there are no members who are celebrating Hanukkah, there's members of the public, and we've had folks in the past say, wow, you guys are just tone deaf, right? Like, why are you holding a meeting on Hanukkah? So we've learned from that. I think that I would avoid that because it's a holiday for a lot of people.
Yeah, it would seem that holding meetings on a holiday, some folks in the public who might want to attend won't be able to.
Yeah, so I mean, it looks like right now, just to kind of recap, looks like we're looking at combining 2 meetings into one, maybe in early December. I'm assuming everybody's going to agree that late November isn't ideal, considering it's so close to Thanksgiving. Right. So that's what I'm hearing so far, but definitely moving December 19th to a different date. If we're going to be keeping Monday, then it looks like we're looking at December 5th and December 12th.
How about December 12th?
December 12th? It looks like we got a 5 up.
5 and 12.
I thought you were doing 5-0. I don't know.
Oh, sorry. I was calling the date. See, that's what we need chat. I'm sorry. Chat and reactions. It'd be much quicker.
Reactions. You could just say it.
Oh.
All right. So we're looking at the 5th. We're looking at the 12th. Looks like there is a vote for the 5th. I definitely agree with the 5th. I'll definitely put my vote towards that as well. And it looks like we do have one person saying the 12th. And then we could take like a vote in like a minute. So definitely give you guys some time to look at those dates. Also want to make sure that works for Mika, Captain Plank, and Chief Campbell as well as the city staff. Make sure that works for you guys as well.
I just one thing I'd say is I don't see any conflicts with something like the council reorg, or I don't see any big conflicts for either date. So from our perspective, but I guess as you correctly identify, the availability of your speakers would be key here. So if one date was better for them, that might be something to consider. But again, I don't see any big conflicts.
So Mika, Captain Plank, Chief Campbell, is there any way we can get input from you guys as far as 5th or the 12th?
I'm personally available either day.
Okay.
I'm checking right now for you.
Thanks, Mika.
You said the 5th or the 12th?
Yeah, 5th or the 12th.
Of December 5th.
Mhm.
I do not have any immediate conflicts with either of those either. So I think that should be fine as long as we get reasonable notice.
And that goes for me too. I can make either date work. There are more than one representatives from the Gardner Center. So I'm going to go out on a limb and say at least one should be available on either day. And I'll confirm that first thing tomorrow in case there is a weird situation where no one would be available.
Okay, but I think it's safe to assume that we can get somebody either of those days.
Yeah.
That's what I'm hearing.
Yes.
Okay, perfect. All right. And then Amy, that works for you, 5th or the 12th?
It's okay with me. I think Mary Jo has a conflict, but we can work around that. We can do either day.
Does she want to tell us which day she prefers? Or I guess we could just vote, right? I think we all could just vote. Including staff and Mary Jo. That's okay. Cool.
Yes, that's fine. I might be on retreat with Lead for America sometime between those dates. I will confirm with my supervisor to see if the dates have been decided, and we'll get back to you.
Okay.
I just would say here, typically it's at the commission's choice. So staff, as much as, it's not that we don't care at all, but I think the commission should just select the date and we'll make it work.
Okay, sounds good. All right, so maybe we can vote then. Amy, do you mind?
Do we need, is that a motion?
Motion.
To make a vote? Okay. And a second from Arnell.
I will motion we have the special meeting on December 5th. Yeah, I got you back, Stephen.
I second December 5th.
Okay. Roll call vote. Commissioner Yee? Is that an aye or a nay?
Sure.
You're the
Commissioner,
one who put a
Yes.
date out there. Sorry.
Commissioner Sanders?
Yay. Yes.
Commissioner Perez?
Yes.
Commissioner Junio?
Aye.
Commissioner Hobson Court?
I've been outvoted. Aye, that's fine.
Commissioner Delgadillo? Chair Cancino?
Aye.
Okay, motion passes. We will plan the next meeting for December 5th.
Perfect.
All right.
Perfect. Okay, so then that would mean that the plans for that third meeting, the presentation for that third meeting will now be in January. Just wanted to make sure that was clear. Cool, okay.
And then just technically, you guys will see a cancellation notice for the other two meetings, which is a technical thing.
Okay. Thank you so much, Sharon. Cool. And then I think there was one other, oh, no, wait. Yeah, so we'll table the Equity Commission retreat. It's already past 8. Is everybody okay with that? All right, so let's move on to the next one. Next line item is future agenda suggestions. I definitely like having discussion time. I'll tell you that much. Even us sitting here and talking about our thoughts on doing the South San Francisco police tour, I think is very helpful. I think it was also very helpful for other people on the call to also hear. I'm assuming that, but yeah, I think just even having like a little discussion time helps get everybody's opinion out there and gets everybody involved. So I definitely like that. So I'm hoping that we can put that on the future agenda, which is even just to talk about Mika's presentation, what we thought about that, any kind of take backs, some questions that we might want to revisit, or even new questions that come up. If you guys are okay with that, just kind of having like a informal discussion around that. Does anybody have any other ideas as far as future agenda suggestions?
Just with that presentation with the Gardner Center, if possible, if these documents exist, if we would, in the agenda packet, if we would be able to include the data use agreement and or a pre-analysis plan, no matter how like technical or academic may be useful or interesting.
Yeah. Thanks for bringing that up, Alan.
I'll note that, thanks.
Yeah.
I was wondering if maybe second or third meeting next year, we could have an agenda item where we kind of do reflection on what we've done, where we are, where we're going.
Yep. There's some other suggestions that I had in mind. I'm a little hesitant to say it, but I'm just going to. Since we're looking at different models of trying to create something more specific for South San Francisco, something our own, I think even having presentations from the street crisis response team, some of those models that we had up in Mika's presentation, the Cahoots, I know street SCRT follows the Cahoots model, so we don't necessarily have to have Cahoots from Oregon present. And I know the people who would present for SCRT, so I could actually ask them to present, but also Crisis, my team in San Francisco, also having that presentation, I think would be helpful, not just for Mika, but for also us, how other cities are doing it. When you have a little bit more support, again, like even just having another clinician to bounce ideas off of is kind of helpful. So again, I'm hesitant to say that, but I really did. So, but I definitely want like these presentations out there so we can see the different models if that's what we're looking towards building. I know I have access to those too. I don't have access to the other ones, but Amy, do you have access to those other models?
I can reach out to anyone. I would actually love your input on who exactly you'd like to come. I can pull up that slide. I've reached out to Cahoots already. I haven't heard back from them yet, but to bring experts in, I figure you probably want like 2 or maybe 3.
Yeah, from Cahoots. I mean, I don't know the team from Cahoots. I know the team from SCRT. So I could have, so they have 3, which is the fire department, a peer and a clinician. So it would be 3 people. Is that what you're asking? How many people from each?
Now, which teams from other cities do you want to come present to the commission?
Oh, Alameda.
Yeah.
Yeah, Alameda, because I know in Berkeley, their crisis team, they don't go, they do go out with PD, but they're also pre-scheduled, if that makes sense. They actually don't respond in real time. They schedule it out. So I've always found that fascinating as far as crisis. So maybe that's something we can look at too. Especially since Mika had said that sometimes there are, she has run into people where she's already had rapport, she already knew those clients, what that model can look like for people that, for lack of better terminology, like not repeat offenders or anything, but people who constantly like come up in crisis, what that can look like for follow-up.
Sounds good, thanks.
Yeah. Cool. Anything else? Vice Chair, anything?
No, I have none. I can save my whatever comments for the ride along for the next meeting.
Oh yeah, that's right. All right, so if we have no more suggestions, let's move on to the next one. Items from commission and staff. Do you want to start with staff? Or any commissioners have any items?
I can speak for staff. Today, I think you all should have received an invitation to a Star Vista fundraising event next week, which was passed on by Sal. Feel free to join if you like. You know, it was interesting tonight. You got to see Mika's technically supervised by Star Vista, so you all might find that interesting. And then the other thing, I'll send out the email tomorrow, is Sharon is getting together an age-friendly task force to have some focus group discussions on you know, issues for adults 55 and older in South City and what you'd like to see for them. So I'll send you that email in the morning. If you're interested in joining one of the focus groups, please do. Or if you just want to pass it on to other people you think might be interested, that would be helpful too. Thanks.
And I think there was one more thing too, right? Amy, we had talked about some document that we wanted them to review before the next meeting.
Yeah, the PD was kind enough to share the training documents and the policy documents on the crisis intervention training. So maybe I can dig into that a little bit and write a staff report for you all. And let me know if there's anything in particular you're interested about there. We can include that.
Okay, perfect. Thank you, Amy. Sharon?
I have just one item. In terms of like a fun thing, we do this wreath workshop and I pitch it all the time. It's on Saturday, December 3rd. And we have a session in the morning and a session in the afternoon. And I'm telling you guys, it's heck of fun. It's really fun. So maybe Amy, when you put out the information tomorrow about the Star Vista fundraiser, we'll send out the flyer. And it's kind of fun when people who, if you all sit at the same table, and if you don't celebrate Christmas, that's okay, because you can make a green, we can do other things. And what we do is we go trim all the park trees, and we have piles and piles of really cool cedar and pine and redwood. And then we'll show you how to make a really fun wreath. So.
Oh, nice.
We'll send it out to you guys. It always fills up really quickly. So if you got, and it's a fundraiser for the Improving Public Places. Any money that they raise, they buy plants and plant trees and stuff with it. So
cool. Thank you, Sharon. All right. Anything else? All right. I think we have finished our agenda. And I think we can adjourn here. Does anybody want to make a motion?
Yes, I'll motion to adjourn the meeting. Absolutely. Yeah.
Thanks. And obviously I second. All right.
Second that.
Thank you, Paula, Claudia.
Yep.
All right, you guys.
Do we have to vote? Is it okay? Okay. Thanks.
I don't think, I think we're done with our agenda, so. Yeah, I mean, we don't have to vote that, do we? No, yeah, okay, perfect. We've had motions, we're good.
So our next meeting is Monday, December the 5th.
Yeah, December 5th, but definitely look out for any communications from Amy. Since we're not going to have 2 meetings, I'm sure there's going to be a big packet of stuff, including probably what we get from the Gardner Center, right, Amy? For that next presentation. So
okay,
definitely look over it. Yep. All right, everybody, have a good night.
Good night,
everybody. Take care.
Night.
Good night.
Good night.